Ladies and gentlemen of Legends to Leaders, welcome. Today we're thrilled to introduce a powerhouse in perioperative leadership, Patti Jagoe. Patti has been a director, an AVP, even a chief nursing officer for hospitals in Connecticut, South Dakota, amongst other places. Today we're diving into the topic of vendor contract negotiation. I think that this is very appropriate given the cost of supplies that has been challenging hospitals around the country. Welcome, Patti.
Thank you, Josiah. I'm very happy to be with you today. And yes, first of all, I want to say congratulations to all the new perioperative directors out there. It's a great honor to be in that position. And you all have been chosen to be in that position because you have key qualities that your organization is looking for. So, and one of them is, being a very strong people person, I'm sure. Also being clinically savvy in your area. But the one thing that we're going to talk about today is, those other pieces of that responsibility that they don't teach you in nursing school. So we'll talk about that. So I'm so thrilled to be here.
Absolutely. And they don't teach it to you in nursing school. So where do you start? How do you get out of the gates and become savvy in negotiating?
Well, it doesn't happen overnight. And this is a team sport, I will admit. The perioperative director is the, clinical expert. And that person has that clinical background. The other two areas that are key to this are your supply chain directors or your supply chain colleagues and your finance colleagues. And so when I first got into my directorship position, and realizing that, one of the key parts of my responsibility is that inventory supply chain piece, I quickly got to know my supply chain folks and my finance people. And so together we worked, and I learned a lot from them as they did from me. So I think that's where it starts, is just to develop those relationships with your key partners that would be part of, making these decisions on supplies. One of the major drivers for hospital revenue is the operating room. It's a huge driver of that revenue. But it's also the highest area for spending on supplies. And so there's that whole piece of the cost of doing business in your hospital. So in answer to your question, it took a lot of time to learn. Was it perfect every time? No. Made some mistakes, made some judgment, faux pas, I guess, if you will. But you learn as you go along. But hopefully this will help others to understand that they're not the only ones going through this. It isn't easy, but once you get to know your colleagues in these other areas, it's much easier to make those changes and implement change.
Okay, so imagine you have just been promoted from nurse manager and now you're director. What are the biggest misconceptions that you might have, and what might be surprising about vendor negotiations as you step into this new role?
I think one of the surprises that I had was to understand that most hospitals are under what we call a group purchasing organization, a GPO. And so it's not that I would go out and talk to these vendors individually. I would consult. I needed to consult with my supply chain and finance colleagues because they know who our group purchasing organization vendors are. And that's where you would start. And in consultation with them, you learn, who that vendor is and why that's important. And the reason that is important is because these vendors, through your group purchasing organization, have also already set up contracts for purchasing. So you would be consulting with them along with your other colleagues on, say, it's a change in a certain item, and you would go through your group purchasing organization. The other thing that I learned was that when we were going through a product evaluation and we were comparing, say, 3 different products, say, for example, some kind of an implant, the thing that is to keep in mind is that some of these vendors also have what you call like tier pricing, or they also have some rebates built in to some of their products. So one widget, let's say one implant, may cost a little bit more than another implant, but if you standardize to this first implant and you commit to a certain volume of that, you get rebates, which then go back to the hospital. So at first, when you talk to your colleagues, especially some of the staff, the frontline staff, or your physicians, it's difficult for them to understand. So you need to be, explain that, this is why. Yes, it may cost a little bit more per implant, but at the end of the day, if that's what we are using, and we're using 80 to 90% of this, of our cases, we use this implant, at the end of the day, our revenue looks better because we are standardizing to that and have that commitment.
If I understand it, right. So if I understand it right, there's the unit cost, but then it may be worthwhile to dig a little deeper and find out whether there's rebates or there's tiered pricing, and that you can actually find a unit cost reduction if you divide it out by, a switch to using the product overall.
Correct. Absolutely.
So between devices and software and professional services and other, what are the ones that you find are most negotiable?
The things that are most negotiable, I think, are probably more of those soft items, like probably more like things that don't really touch the patient or don't like the surgeons don't use, things that are transparent to them, I think are those kinds of things that are easier. Let's say someone who cleans our OR. That might be, if we have an outside company that comes in, that may be easier to negotiate because I don't have to necessarily involve surgeons or not necessarily the staff either. So those kinds of things that we can make decisions on without having to consult a whole group of people, that's easier than something that we are looking to change that a surgeon might use every day. That's going to be a lot more difficult, a different conversation, different set of circumstances.
Okay, that's fascinating because so you have a surgeon who requests a device, and how does that play in? Can you use that surgeon to advance the negotiation in sort of triangulation, or does that frankly hamstring your negotiation ability because you've got the surgeon that's also applying pressure to make the purchase?
Yes, and that goes back to a well-established value analysis committee. And there are all different sizes of hospitals. Some people have a robust program. Others, it may just be the chief of surgery and the director and the chief of the supply chain director. But I think it goes back to that fundamental having a process in place that if any new product is going to be looked at, wherever that comes from, it could be a surgeon that goes to a meeting and sees this new product displayed and wants to try it, or one of the nursing staff sees something at a meeting and suggests we try it. So these requests come in from all different places, areas. So if you've got a robust program where everybody understands what that process is, it's a lot easier. So say a surgeon goes to that meeting, they see there's this new technology out there. They say, yes, this is something I really would like to try. Then you would put it through its paces. It goes to the committee. That surgeon would ideally, write out their justification, and the chief of surgery typically, or the chief of any of the specialty areas would be on this value analysis committee, because it's key to have your physician partners as part of that decision making. So, it would go through that process, and perhaps we see there's another vendor that has that same item. So we might want to compare those. So it's a process. As I said initially, this is a team sport. This is not just, the peri-op director making that decision or the surgeon making the decision. It is a group effort when we make those decisions.
I'm glad you mentioned the value analysis committee. So imagine it's a newer committee, or it's a little bit more informal than maybe many big hospitals have. Are there some ways that you should be thinking about how a value analysis committee should work, whether they be rules of thumb or some things that work better or some things that work worse when working with a value analysis committee?
Yes, and there should be you should have your process in place, the rules of thumb. That should be the first thing. And I guess, you would probably want to work with your supply chain director for sure, and make sure that they are involved in setting up those requirements to bring things forward. Also, your OR committee or your, operations committee, get them involved in making these rules as well, these rules of engagement, if you will. And you would start there. And then communication to your surgery staff is also very important. Once you have these guidelines down, make sure that you're communicating that to your surgeon staff, to your OR staff, and supply chain, will be there to help support as well. The supply chain director doesn't want to be changing products every 3 or 4 weeks. They don't want to do that. So they will be involved. They want to help as well, to help you from a clinical perspective. So that's been my experience, and it's been very successful that way.
Got it. So imagine there is a negotiation about to occur. In other words, it doesn't touch the patient, perhaps. You feel like it is not part of the group purchasing organization. It's got its own negotiation sort of available to you. Walk me through a little bit about what steps that you might take to prepare for that negotiation.
What I would look at is, what is our current process? What is our current cost? What is, the current, like a contract that we currently have with, say, we already have a vendor. What is their current contract? And say you would like to go out and explore other vendors. So then you would get that comparable information from those vendors, and then look at their cost. And you also need to look at, and the other piece of this isn't just the availability or the cost, but it's also the quality. So you would also want to have that quality piece in there as well. So let's say your current vendor, let's say it's for housekeeping services or environmental services.
Okay.
And you're finding you're not satisfied with the work that they are doing, and you want to look at another vendor. So then you would want to compare, like, what your expectation would be, what they could offer, and what their timeline is. So there are multiple different pieces you need to look at, but then you also need to look at the cost. And then you also need to look at, is this a vendor that's within our GPO? So those are the pieces you'd put together. I'd tap into my finance people, put all the financial pieces together. As far as, like, what's the monthly cost, what is their turnaround time, things like that. So there are lots of different pieces that you would put together in that. And then you would, let's say you have another vendor that you want to come in, and you would have a discussion with them. And then I also part of what my experience has been is working with my finance people on writing up what we call a pro forma, making sure that, we would look at that contract and then, compare the two together and make a decision.
What's in a pro forma?
The pro forma talks about mainly about the financial pieces, what is going to be the cost, what is going to be the revenue, if anything, now with housekeeping services, that's not revenue generating, but, you would look at, if it was going to generate any revenue, you will look at the cost over the revenue and making sure that if it is something that would be generating revenue, what that revenue would be. And so that's kind of, to make it simply, that those are the pieces that you would put together to take a look at. And at the end of the day, if it generates revenue for the hospital, then that's a good thing.
Got it. If you're a executive and you're recruiting and you're interviewing nurse manager candidates, as well as maybe external director of surgical services candidates, and you know that contract negotiation is a skill set that you want to have in your director of surgical services, how do you ask questions in an interview? How might you be screening for a potential good negotiator?
Well, I think I would look at how they actually have performed in the clinical area. If they've had any disagreements or if they've had any issues between, some of their colleagues as a manager, and they want to be a director, if they've had any kind of interaction that way, and how did they resolve it? What did they look into to resolve it? And what were the pieces they needed to evaluate to resolve it? It's as basic as that sometimes. But I would also ask if they have had any experience with working with vendors, if they've had worked with their current director, with any of those kinds of things, if they were involved in a value analysis committee, if they've put any time into that, those kinds of things as well, I would ask as well.
What behaviors does a director show that drive strong partnerships with vendors?
It is communication. Communication is key. If you have, good communication. However, vendors are very savvy when it comes to trying to get information on other vendors that you might be engaged with. And that is, we should never discuss anything we are discussing with one vendor with a competitor vendor. That's, the rule of thumb is we do not discuss any other vendors. So you keep that focus on what they are there for and what our discussion is. And I've had to do that. I've had to bring them back to, I'm sorry, I'm not sharing that information, but we're here to talk about your contract and what you can do.
So imagine you're a newly promoted director, you watch this video and you say, I need to improve my skills here. Are there some books? Are there some methodologies? Are there some classes that you might recommend that a director can go to get further training?
I think the first person that they would want to reach out to is their supply chain director, or if there's a VP of supply chain. Those folks are the experts, just like, the directors, the nursing directors, we are the experts in the OR. We don't ask our finance person to go in and scrub a case, right?
Right.
We will not know everything, every little nuance, but the supply chain directors has multiple experiences with vendors that they really are the experts. So that's probably the first person I would go to. But there are many materials out there. The Association of Perioperative Nurses as well has, vendor management, articles and best practices as well. So your professional organization would have information on that as well.
Well, this is terrific. Thank you so much, Patti. So what I'm hearing in terms of vendor and contract negotiation, a couple of key points. One is the sheer importance of the supply chain and the relationship with your supply chain leader, secondarily with your finance leader as well.
Right.
We also heard today that if it doesn't touch the patient, that may be a rule of thumb that there may be a chance for negotiation. Also to look at rebates and tiered pricing. Is there anything that we didn't touch on that you wanted to address today?
Well, I guess I don't think so. I mean, I'm hoping that this information will help others to understand and to kind of peel back that onion of, what is this, what is this contract negotiation? What does that mean? So I'm hoping this did help. And, I'm more than willing to speak with anyone who wants to learn more.
Well, sure. Thank you. Patti, thank you so much for your insights. Thank you for your years of service. Thank you for your leadership within the AORN and the perioperative community. You've been a great leader for the next generation of leaders. Until next time, this has been Legends to Leaders, and keep up the great work.